In 2011, medical identity theft cost the U.S. healthcare system, including taxpayers, over $30 billion. It doesn't matter who you are, where you live, or what kind of medical care you need. Everyone is at risk. Medical identity theft can and does happen anywhere. Nearly 1.5 million Americans were affected in 2011, and right now it is virtually impossible to detect until it has already happened.
I'm Terry Tone. I'm the administrator at Affiliated Community Medical Centers. We operate in 11 counties. We have 12 locations, provide primary and secondary care, work with 6 major hospitals, 5 of which are critical access hospitals and 1 of which is based on DRG reimbursements. And we see about 700,000 patient visits a year.
Like many clinics, ACMC struggles with the impact of medical identity theft.
We started noticing it about 5 or 6 years ago. One example would be that we have had 2 patients show up at the same time with the same identity. Came in about an hour apart. One guy's coming into urgent care to be treated for, I think, an upper respiratory infection or something on that order. The other guy was injured at work.
Good morning, can I help you?
Yeah, I have a really bad chest cold and it's not going away, and now I'm having trouble breathing. Can I see a doctor?
Sure, what's your name?
It's Mike Stevens.
Mike, do you have an insurance card?
Yep.
Thank you.
At the time, nothing seemed to be unusual about this patient or situation. However, a couple hours later, another patient registered using the same identity.
A patient was in to be treated for a work comp injury, and of course had him registered in the system.
Hi, can I help you?
Yeah, I had an accident at work. I think I might have broken my wrist.
Okay, what's your name, sir?
Mike Stevens.
And in the process of registering him for some radiology procedures related to the accident, we realized that the same exact patient was already registered 2 hours earlier in our urgent care department. Well, we still got to provide the care because the guy's got a fairly significant fracture. The patient wouldn't give us any more information than we already had, so we basically took care of the fracture and sent him on his way. So we ended up treating both patients, but we ended up, of course, eating the charges, so there was no reimbursement. But even worse, we now have 2 different sets of medical records combined under one chart because they're both supposedly the same person.
The only thing that's unique about this scenario is that ACMC was able to detect this kind of fraud. Normally, 2 members aren't walking into the clinic at the same time. It's almost impossible for healthcare providers to detect and stop this kind of fraud. At a time when healthcare costs are front and center in the national debate, it's important that we leverage technology to help stop medical identity theft.
The big concern by the healthcare professionals here is that, we have a chart now that's compromised. From a business perspective, which is partly my job, I'm concerned because in a lot of cases we have expended a lot of resources to take care of these people, which is our obligation, but we have no way to bill for it because once we know it's not the right person, it becomes a fraud issue, and so therein lies the problem. Everybody's trying to lower costs of healthcare, and administrative costs are, of course, the target for everybody. We have to still go back and correct that claim, which is extremely expensive. Running that all down is an administrative cost that isn't necessarily something we should be paying for, either as a society or as a clinic.
Healthcare providers have important concerns as well.
Well, it's really a problem when a chart's not accurate because the physician or any provider is acting on the information there to provide the quality services. There's also issues in terms of how we would actually address a particular diagnosis because we're making medical decisions based on the information that we're given.
But new technology developed by Prime West Health can stop medical identity theft. Introducing the Smartid.
The Smartid was designed to give providers the tools they need to detect medical identity theft.
Good morning, can I help you?
Yeah, I have a really bad chest cold and it's not going away, and now I'm having problems breathing. Can I see a doctor?
Sure, what's your name?
Mike Stevens.
Mike, do you have your insurance card?
Using state-of-the-art technology, the Smartid allows the receptionist instant access to the member's real-time eligibility information, including a color photo of the member for instant identification.
In this view, the receptionist notices immediately that the person standing in front of her is not the real Mike Stevens.
Mike, if you'd have a seat right over here, the doctor will call you when they're ready. Thank you.
Thanks.
Hi, Mary. We have a patient here who's checking in, and his photo does not match the photo we have in our system for the Smartid.
With the Smartid, medical identity theft is stopped before it starts.
Hi, I'm Jen Brown. I have an appointment with Dr. Thomas at 2.
Okay, do you have your insurance card with you?
With the Smartid, we've made check-in quick, easy, and accurate. A chip in the card carries a unique identifier that allows the user access to the patient's records. The records are housed in a secure location, not stored on the card, and can only be accessed by pre-authorized users. And access is limited to need-to-know information protecting patient privacy. For example, the receptionist only sees the eligibility information she needs, not the patient's medical records.
Are you still at 2209 Jefferson?
Yes?
Great. Thank you, that's all I needed. Please have a seat, the doctor will be with you shortly.
Thank you.
The benefits don't end there. In the future, healthcare providers will be able to use the Smartid to gain instant, up-to-date access to patients' medical records.
Your blood pressure is still higher than I'd like, and I notice you haven't refilled your blood pressure medication in the last 2 months. Is there a reason you haven't been taking the medication?
Well, I don't really like it. I don't feel any better when I take it.
In this view, healthcare providers will be able to access patient records and claims data from any clinic, hospital, pharmacy, or other specialty providers, allowing them to provide the right care at the right time.
Let's look and see if there's another medication we can try.
Okay.
The Smartid technology from Prime West Health offers a simple, secure solution to a $30 billion a year problem. It allows healthcare providers and payers to eliminate medical identity theft, reduce the number of duplicated tests and services, reduce prescription drug waste, maintain accurate patient records, deliver better patient care, and protect patient privacy. The Smartid from Prime West Health, a solution for everyone.